Hi, my name's Katie. I'm an occupational therapist here at the Cheyenne Clinic. I'm a clinic director and I specialize in feeding, sensory integration, and pelvic floor therapy. Pelvic floor therapy takes a very holistic approach to any kind of concerns that involve leakage of urine, leakage of even feces, or pain during sex or any other time during your day around your hips or uterine area. It can also help with any frequency issues. Many women have pelvic floor concerns because they've heard their mothers have had similar concerns, friends have had similar concerns, and we tend to just push these issues under the rug. But even though it's a common issue, it doesn't mean that it can't be fixed and that we should be living with these every day. Hi Kim, welcome to your first evaluation for pelvic floor therapy. Today we're going to just sit and talk, get to know each other, create a treatment plan that's best for you and your body to hopefully help you with your symptoms. First, I'm going to just kind of educate you on what is pelvic floor therapy and how we're going to kind of expect treatment to go from here on out. So really our pelvis is the main part of our body. Our glutes here, our back here, and our central nervous system from our brain goes directly connecting to our pelvic floor muscles. So we tend to do a lot of stretching, a lot of strengthening, especially in your abdomen and your hips, to make sure that this pelvis is supported really well so that these muscles can do the one and only job they're supposed to do, which is stop and start your flow of urine, not hold up your pelvis like they're probably doing right now. If you were to come to pelvic floor therapy, our first session will be mostly just sitting and talking, getting to know each other, understanding each other's goals. So the first day it's going to be about 30 minutes of just talking, and typically we get to a little bit of stretching at the end of the day because what we find is a lot of our patients have really tight back and hips, and that's got to be the first thing that we target, is really making sure our patients have a full range of motion. All right, we're going to try to stretch your hamstrings out, so you're going to hold on to this rope. Keep both of your legs straight, and now we're going to pull your legs straight up. Hold it for as long as you can. About a minute is the goal. What this is doing is stretching out those legs, that part of your leg that is probably really tight and a little overly strong. And so we want to open up and to give you that pelvis that full movement to allow for all the muscles to work fully and gain the proper strength in the long term. Good. Now you're going to just push your leg across, kind of kick that blue wall, and you'll feel a little bit more of a stretch on the outside of your hip. Again, just continuing to try to get that full range of motion for that pelvis to get it nice and strong eventually. Very good. You're going to bring your leg back down for me now. You're going to just hold and pull it towards you, bending that knee. You get a good quad stretch. So now we're stretching that other side of your body. Good.
I felt all of them.
Yeah. Good, good. All right. So now we're really going to focus on making sure we're using only our stomach and the outside of our hips. We really want to avoid using our back at all costs. So at any time you feel anything in your back, let me know and we can make this exercise a little bit easier. So the first thing we're going to do is a bridge. So just bend your knees and keep your feet on the table. Rest your head on the pillow, and now you're going to pretend there's a rope coming through your stomach. So I'm just going to pull up on the rope, and you want to squeeze with just your stomach, not your back. Good. And then bring it back down. Good. And then go ahead and go back up. We're going to do 5. Good. And down. 2. 3. 2 more. So this ball's going to go between your knees. The most important thing is that your back is flat on the table. We don't want any arched back, so keep your back flat. And then you're going to just squeeze your knees and then relax. Good. And you're going to do that 10 times while keeping your back flat, no arched back. We don't want you to feel any pain, and most definitely we don't want you to feel like your back is getting tired or sore. You might have to feel like your glutes are getting a little tight, but our main focus is really making sure our stomach is tight and squeezing every time we do a squeeze. Our first one is going to be clamshells. I'm actually going to have you start on your back. That's the easiest way to do it. So you're going to lay on your back, bring your knees, feet back up for me, like you're about to do a bridge, and then you're going to just spread both of your knees apart. Good. And then bring it back together. If you need to add a little bit more, adding a therapy band or resistance that you could get in therapy around your knees and pulling it out is a really great way to start it. Now, to make it even harder than that, I'm going to have you roll onto your side for me. Good. And make sure your feet are aligned and your back is flat and straight. Good, and then bring up your knees just slightly for me. Good, and now you're gonna keep your feet together and just lift your knee up. And it's okay if it doesn't go.
knee?
Yep. It's okay if it doesn't go that high. We just wanna make sure our back is not being used. So make sure your back is flat and straight, is not hurting or getting tired, and you just bring your knee up. You should feel it actually exactly where your hand is located. That's where you're gonna start to feel that burn.
I do.
Excellent. And then to make it extremely hard, we can put a resistance band in this position around your knees. Hopefully, after a few sessions of coming here, probably in session 8 or 9, we're going to progress you to get this band around your knees. That's really going to make sure that we're stabilizing that muscles in your hips and we're no longer compensating with our back. So that'll really help put that support and symmetry and balance into our pelvis so that our pelvic floor muscles no longer have to help support our pelvis. They can do what they're meant to do, which is just stop and start the flow of urine and not cause any pain. Everything I taught you today is really important to continue to do at home. I ask that you do the stretches every day, especially if you're feeling really tight in certain spots. So as you notice in those hamstrings and in that back, make sure you do those stretches and hold them for a minute every day. However, you're not going to get to that symptom-free zone until we get those abs and external hips really strong and tight. So we ask that you do those exercises about 4 times a week. It is important to let your body rest, so you don't need to do them every day, but you do need to get into a habit of doing them very frequently so those muscles can get stronger. Otherwise, we're going to continue to compensate and those symptoms are going to continue to go.
How often?
I want you to do the exercises 4 times a week, the stretches every day if possible, and we'll continue to grade up the exercises. Once you are symptom-free, you don't need to do the exercises every day, but I would do them probably once a week to check in, make sure everything is balanced and symmetrical.
Okay. How long of a period of a time, or
So,
the number? Or you'll give me a chart?
Yeah, I'll give you a home exercise program to really make sure you're doing all the stretches and understanding how long to hold each stretch. They're typically about a minute, and every set exercise we typically do about 2 sets of 10. However, I'll work with you to make sure it's what's best for you and what your body needs. I might be a little biased, but I think almost every woman could utilize pelvic floor therapy. We tend to really underestimate the issues that are going on. Even if you're coughing and sneezing, that really shouldn't be a typical pattern that we as females have to deal with every day. Starting pelvic floor therapy, it usually takes between 6 weeks to 3 months, depending on patient case-by-case basis. The sessions last anywhere between 40 to 60 minutes. We'll be educated on what those tools or other methods could be if we find it helpful for you. But in many cases, just stretching and exercising is really all that the patient needs in order for their symptoms to get better. And I feel like another major myth that in pelvic floor therapy is even though it is a common symptom, it doesn't mean that it's a symptom that we should be dealing with. And you can seek help, and with just simple stretches and exercises, you can get better in less than a month and a half sometimes. In order to come in for pelvic floor therapy, if you are a private payer, you need absolutely nothing. You can just show up and call our office and schedule an evaluation. If you would like insurance to cover it, most insurances require you to get a referral, which is just simply either your gynecologist or primary care physician writes a prescription stating that you would benefit from pelvic floor therapy. If you're having any issues with leakage, pain, discomfort, or feeling just a loss of control with your body, please feel free to call or email us at Optimal Therapy, and we'd be happy to answer any questions and hopefully see you and get you back to feeling powerful and in control and happy and healthy.